From NBC News, this is Today.
Then it is all in the family. We will meet identical triplets who decided that they wanted to age a little bit more gracefully, and they let us come along as they went under the knife, and we went them one better and gave them a whole makeover, hair, clothes, and all. Gotta say, they looked pretty good before they got started, but they're really looking good now, and we'll give you a peek in just a couple minutes. And still ahead, triplet makeovers. First, these messages.
That's right. Also an interesting story about these three triplets who decided they needed a little lift, and not an emotional lift. They actually went under the knife, and we're going to show you their before and after, and I'll tell you, I just talked to them. They look good.
It's coming up. We've got triplets who went under the knife and let us watch.
And we are back this morning on Today's Style, a makeover 3 times. 57-year-old identical triplets were inspired by a story that they saw right here on the Today Show. So they looked into getting plastic surgery, and they decided to go for it. All for one, one for all. The Maddox triplets were born in 1949 in New Brunswick, New Jersey.
Yes, we're identical.
There's Jerry, a library program coordinator.
Jerry's a very hard worker. She's we're all a little compulsive.
Gail, a librarian.
Gail is a very undemanding person. I can never remember a time when she really asked for anything for herself.
And Georgette, a teacher.
Georgette is probably, if you're comparing us, probably the most opinionated and has very decisive ideas about things.
And it was Georgette who called plastic surgeon Dr. Darrick Antell after seeing him on the Today Show in March.
She actually came up with the idea.
And together, all 3 sisters decided to go under the knife.
But I'm hoping to have less of this here. I'm hoping to have smoother skin, get rid of some of the sag.
I'm hoping to kind of push the clock back a little bit, maybe look a few years younger.
They had the surgery in May, 3 facelifts and 3 upper eye lifts.
I would not do this by myself. I probably would do it on my own, although it makes it a lot more fun to have some buddies doing it with you.
It was okay.
Piece of cake.
3 sisters, 3 different personalities on one great big adventure.
I think it's a great adventure, and I think it's elective surgery, and I elect to have it.
And the adventure continues. Dr. Darrick Antell is the New York City plastic surgeon affiliated with Lenox Hill Hospital who worked on the triplets. And when they were feeling up to it, we sent the Maddox triplets to Louis Licari Salon here in New York City to get their hair done. And Rebecca Dolgen is the beauty and fashion director of All You magazine. She took them shopping. So the moment has arrived. First, we do want to take a look at the before pictures of the triplets. This was before the surgery, before their makeovers. And now, drum roll please, Georgette, Jerry, Gail, come on out. Let's see it. Show America the new you. Oh, wow. Ladies, you look fantastic. Everybody feel great?
You feel wonderful. It's fabulous.
We're going to talk about how your take on sort of the makeover. But first, Dr. Antell, let me start with you. What they wanted to go for was obviously a younger, fresher look. As we showed the before pictures, before and after comparisons, tell us about the surgery, what you did exactly.
Well, Campbell, I've always believed that plastic surgery should whisper and not scream.
Right.
And we're doing ongoing studies on identical twins where we've been able to do a much smaller incision than we previously could do.
So the idea is to make it more subtle, not so obvious.
Not only make it more subtle, but safety. These operations today are done under mostly local anesthesia with only mild sedation.
So give us an example if you can. I want to throw the before pictures back up for a second. And just show us where you made an incision with one of the women and what exactly you were going for.
Well, in Georgette on the far left and also on Jerry, we used a much shorter incision. And on Gail, we used the more traditional incision. But their neckline is much cleaner on all 3 of them. Their upper eyelids are much cleaner. And the recovery is potentially shorter with the shorter incision.
Well, let me ask you, ladies, and Georgette, maybe you can speak for the group. How long did it actually take you to recover from the process?
Actually, the surgery for me was very, very easy. I'm the one who never took so much as a Tylenol
Really?
for pain. I was very bruised in the sense of being black and blue, but there was no pain.
Would pain, Jerry, for you guys at all? A little bit?
Just a little bit. Very minimal, though. Very.
Gail, no pain?
No
Really?
pain. It was amazing. I had a little swelling, little discoloration, no pain.
Things have changed.
When I woke up, there was no nausea, no headache, and that's due to the local anesthetic, I think.
Yeah. And then let me turn to Lewis now, because when you guys were feeling a little better, Lewis took over, and your goal here was to, again, younger, fresher, get the gray
fresher,
out, right?
and this is the best time. If you're going to change your look, do it now, right when you're going for it to be tweaked, a little face work, because they'll throw all your friends off. They'll say, wow, you look great with a new haircut, hair color.
Yeah.
But they'll never guess that you had a little...
Okay, so they think it's the hair color and they don't notice the surgery.
That really big change.
Good thinking, good thinking.
You know, so it's a great time to make yourself over.
And this is a modification, basically, with each of them that you did on the same haircut, right?
Right, they all have basically the same haircuts, but what we did here is we played with the way that the hair falls. You see on Georgette, we gave her a full bang. She has a long oval face, and we wanted to make it more oval.
Right.
We did the same thing all the way through, except for on Jerry, we gave her hair parted off to the side, and on Gail, even though her hair is up, it's tousled, so it cuts down on the sides of the forehead.
And you can, I guess, all three wear your hair different ways, too. It's really fun and flexible. And Rebecca, let me turn to you and tell us about their looks.
Absolutely.
You gave them the clothing makeover.
Exactly. Wanted to give them a whole new wardrobe, and you can really do this without spending a lot of money. Each one of these outfits ranges from $50 to $150 head to toe, including shoes. So with Georgette, we wanted to give her a pop of color, really show off her bright complexion. And then we put her in a pair of white pants. It adds polish, makes her look great. They have a little bit of lycra, so there's some stretch in them. And I think she just looks fantastic.
Okay, so ladies, what's on the agenda tonight? Big plans? Are we going clubbing?
We're going to go to a show with my family tonight, so.
You look fantastic.
Don't they?
You really do. Hey, congrats to all of you. Well done.
Well, thank you, Enid and Terry.
And enjoy the holiday weekend. Good to have you all here. Coming up, Rascal Flatts is going to be live on the